Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to have you with me today. And today we are going to tackle some of the challenges of pharmacology. Oftentimes, students come to me and say that they are having some real challenges with that course. And the reality is, it's a hard course. There's a lot of really challenging words, and how the body reacts to the drugs that our patients are taking is important for us to understand, and sometimes really hard to know. And there's some basic things that can really help you. If you can understand some of the foundational pieces, then it will help you really dive into pharmacology and perhaps, dare I say, even grow to like pharmacology. And I always like to start with the terms. If you can understand the language of pharmacology, maybe that will even set you on the right path to taking the next step in learning more about pharmacology. The reality is a lot of our patients come into the dental office and they take medications. And as a dental hygienist, as a medical provider, as a healthcare professional, we really need to understand how those drugs interact with some of the things that we're also doing for treatment and procedures with our patients. Some of the side effects, some of the impacts on the diseases that we treat, and how those things can impact the outcomes of what we're trying to achieve with our patients. So I think it's really important as a dental hygienist to have a good knowledge base on pharmacology. Yes, you can look things up. We have the information right at our fingertips. And I will say that as you develop your skills in the clinical setting and see more complex patient medical histories, some of the pharmacology will come easier, especially if you're a visual learner and you like to connect the dots between what you see clinically and then what the medical history reveals. So I will say that most of pharmacology, once you start implementing it in the clinical setting, it gets a little easier. But you also have to know it to get through your boards and see your patients safely while you're still in school. So the first thing I'd like to do is just go over some of the terms. I'm going to name about 10 terms that are the basics of pharmacology, and then just give you the definitions of those terms to help you begin to think about the language of pharmacology and how sometimes just understanding the language goes a long way at helping you with the rest of the stuff. So the first thing is efficacy. And efficacy is the maximum effect that is achieved regardless of the dose. And this depends on the drug action and the capability. So when we think about efficacy, that's what we're talking about. What is the effect? The effect that the drug has on the body for the condition or the symptom. And then potency. Potency is just a relative term based on that dose. And a lower dose is something that might be more potent than something else, can still have the same efficacy for our patient. So efficacy causes the effect, and potency is the amount needed for the effect. The next term I'd like to share with you is onset. And onset is just the time it takes in order to feel the effects of a drug. And this can also be impacted by the administration, the route of entry, how we take that drug. That really impacts the onset. Some things are very quick onset just because of how it's administered. So when we administer a drug through IV, that is the very fastest onset. And when we administer a drug by mouth, oral, that is actually the slowest onset. So it's important for you to know the word onset when it relates to pharmacology. The word duration is the length of time that the effect of the drug lasts. So how long is the impact or the efficacy on this particular drug? This is your duration. This is why we have different dosages at different times and different potencies. And this is important for you to know, the duration of that drug impact. How long is the local anesthesia that you administer to your patient going to last? What's the duration? The patient wants to know that because they don't want to have a 1-hour procedure and then have local anesthesia impact them for an entire day. So duration is important for us to know on some of the things that we use so that we can provide the patient with information on what the range is for that duration of that medication so that we can tell them when they should expect that local anesthesia is going to wear off, just as an example. And then we have half-life. Half-life is the amount of time for the drug to fall to 1/2 of its original concentration in the bloodstream. That is the half-life. And if you've taken any kind of chemistry classes, then you've heard the word half-life before. Absorption is another term. And absorption is the transfer of drug molecules from administration to plasma. And this is the rate of impact by either the route, how it was administered, the solubility, and the ionization. So that is the absorption. It's important to know the absorption rate of a drug. The therapeutic use is when a drug is prescribed for what is intended. And you will see that there is some stuff called off-label use. Some medications can be used off-label, and that just means that it's used outside of its therapeutic use for what the drug was originally intended. Perhaps we find out ways that a drug can be used in different ways to benefit the health of the patient. That would be considered off-label. But the therapeutic use is when it's prescribed for what its original intention was. So when that drug is prescribed for a specific outcome outside of the original intention, that is considered off-label use. So I think one of the things students have a really hard time with is the drug names. How did we end up with all these crazy names for these drugs? Now, there's trade names and generic names, and I would say that actually makes it more complicated, at least that's my opinion, in learning some of these drugs. Now, a trade name is just a new drug that comes on the market, and it comes with a patent for all the people that were involved in developing this drug. So they hold the patent or the rights to that drug for 17 years. Once that 17-year time has elapsed, then other companies are provided the opportunity to create the generic version of that same drug. And this provides patients with more options because of cost impact. So with generic names, each drug is given a unique name. And after that 17 years and the patent runs out, the generic names come out. And I think that causes a little more confusion for students. And we can just use Advil as an example. So Advil would be considered a trade name, and ibuprofen would be considered a generic name. And when you look at this in documentation, the generic name is usually a lowercase letter and the trade name is an uppercase letter. But what's complicated, and I'm just using Advil as an example because it's widely known and widespread, is that Advil and ibuprofen are the same, essentially the same medication. This can be really challenging for students when you start stepping outside something that you're familiar with and you start looking at things like high blood pressure medications, and you're learning the trade name and you're learning the generic names. And patients will come in and they have a really hard time with the names of the drugs as well. So there are regulatory boards that govern all of this trade name and generic name use. And you will get to know some of the more popular prescription drugs out there. But I will say that in the beginning, when you're first learning about medications, the trade name and the generic name cause you a little bit of additional stress. And that should be known because I think it will help you a little bit as you're learning. And maybe however you are as a learner, if you're developing your study skills and putting the trade name and generic name in different categories or grouping them together in a way that you can understand that, yes, in fact, these are the same medications, make yourself a little cheat sheet so that you can have a visual representation of that. That might go a long way at helping you kind of digest all of this stuff. So some of the oral manifestations of the drugs, and this will be the last piece that I talk about in this particular episode. One of our biggest issues is xerostomia, dry mouth, because we know that when our patients have dry mouth from some of these medications, it really increases their caries risk. Right. And what do we throw at that? We provide them with the opportunity to do fluoride. But the reality is when our patients have dry mouth, um, and we give them fluoride, we're actually relying on the calcium and the phosphorus that's in the saliva to help the fluoride have an impact on remineralization. So it's really challenging for our patients because they actually need that saliva to have the full impact of the fluoride at remineralization, and yet they don't have the saliva. So we're giving them fluoride and it's not having the impact that we want it to have because of the reduction in saliva. And fortunately, there's been a lot of improvements on opportunities of different products that we can provide our patients with to really help them combat the impact of these oral manifestations. And you're going to learn in your pharmacology class that antihypertensive, antidepressants, anticholinergics, antihistamines, and adrenergic drugs, they all cause xerostomia. And this is such a challenge for our patient. We can have a patient who goes their entire life with a relatively low caries risk. And the minute one of their chronic diseases pops up and causes them to go on some of these drugs, we will see a ramp up in their caries risk. And it's really hard for our patients to manage because it's really not something that they've dealt with before. So they're going to rely heavily on us as their healthcare provider to provide them with the education, the resources, the understanding of really what's going on in their mouth. The other thing that happens sometimes with these drugs that patients take is gingival hyperplasia. And gingival hyperplasia is the other beast that we're dealing with. We're dealing with the tissue, right? So any kind of periodontal issue that is impacted by the drugs and medications that these patients are taking, that's our wheelhouse. That's an area where we can work with the nurses, the pharmacists, and the physicians to see what's going on with our patient and really see, are there alternatives to some of these medications that our patient can take, especially if they're struggling with some of these oral manifestations. And as a hygienist, some of the prescription and non-prescription drugs, what our role is, we need to know what the medical complications are and some of the emergencies and situations that can arise as a result of the medications. So it's really important as a dental hygienist to have an understanding and a good knowledge of some of the complications, some of the interactions, some of the symptoms that patients experience with taking these drugs as it relates to the two main diseases that we are trying to arrest, as well as some of the relationship between some of these medications and local anesthesia, the use of nitrous, and also the use of some of our topicals and fluorides. And, the dental hygienist may be required to administer a drug in the time of a medical emergency. It's really important for us to have an understanding of this knowledge. And as a dental hygienist, you are a medical provider and you're expected to collaborate with providers in different disciplines who treat these patients that you're seeing. So you have to understand prescription drug use and the risk, as well as some of the possible side effects. And this is why I'm recording this episode for you, just to kind of give you the why behind taking this course. You should learn to understand how the drugs work, how they interact with other medications, and how they promote adverse reactions for some patients. It's important for you as a hygienist to consider all of these things and perhaps schedule your appointments with your patients based on their medical history and some of those findings to reduce the risk of any complications for your patients who have disorders, who have disease or conditions that are making it so that they come in taking some of these medications that cause some of these side effects. If you have a diabetic patient who's coming in, what time of day is best to see that patient? What medications is that patient taking? What stability level is that patient at? Different diabetics are in different places as far as their ability to control. Are they controlled, uncontrolled diabetic patient? And how are you going to best manage that patient? What time of day is the best time of day to see that specific patient? What types of questions are you going to ask that patient about when they come in? How are you going to manage the appointment to impact the patient in a positive way and contribute to the successful outcomes of helping them manage their disease, both their chronic disease and their oral disease? How are your treatment plans and time of day scheduling with that patient going to benefit that patient? What type of questions and information are you going to share with the other providers in that patient's network so that that patient is getting comprehensive care all the way across the board? Is the diabetic counselor, is the physician, do they understand what's going on with that patient in their mouth? Do they understand the impact that the medications that that patient is taking is impacting their periodontal health or their caries risk? What types of conversations are you going to have with those healthcare providers so that you are providing a comprehensive treatment plan for your patient and treating them in the best way that helps them manage their disease? The other big thing I want to talk about outside of diabetes is your anxious patient or your epileptic patient. Sometimes those go hand in hand. Sometimes our patients with epilepsy can have a trigger from anxiety or being in the dental chair. What types of modifications are you going to make in order to successfully treat those patients in the clinical setting and understand the drugs that those patients are taking and how they impact your ability to stabilize their caries risk and their periodontal risk? Now, I know that pharmacology is one of the harder courses that you take when you're in dental hygiene school. It's okay. And you may not be an A student in school with understanding all these drug names and classifications and all the complexities. Just try to learn the basics and develop an understanding of the why and how it's all connected so that when you get out there and you're working in the clinical setting with patients, you can start connecting the dots yourself. Learn the basics so that you can really provide comprehensive care to your patient and have a collaborative lens with the other providers that are also treating this patient. It'll go a long way in helping you develop a really in-depth understanding over time. Everything takes time, guys. The in-depth understanding that you need to have for pharmacology takes a while. It did for me. I was not a great pharmacology student in school. It took me a long time to understand all these drugs, never mind how to say them. It's just a complex class. And I will say it does help you if you go back to your A&P class and review how the autonomic nervous system works, because all of these drugs impact that. So understanding the sympathetic and the parasympathetic nervous system really helps you with pharmacology. So you might have to dust off the cobwebs in that area. I hope this episode was helpful for you. I hope your journey through dental hygiene school is going really smooth. Just keep in mind that everyone takes a different path and everyone's journey is not straight. And know that I'm here to help you along your way if you need it. Reach out if there's a topic that you need me to cover. I really appreciate you listening. If you have the time, I would also appreciate a 5-star review. It really helps me reach more students. Hang in there and look forward to Christmas break, get some well-deserved rest, and finish the semester strong. Take care, guys.